Hello, I'm Dr. Johnson. I'm your host, waiting on some people to join us. So if you want to share this screen, just press the button at the bottom of the screen. As you know, sharing is caring. And if you have a friend you want to hear this message, just tag them. So welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson. Today we're going to talk about, continue our topics on bleaching products. Today's topic is going to be on tranexamic acid. Tranexamic acid actually is indicated for people who have bleeding disorders. So women who tend to have prolonged bleeding during their menstrual cycles, they're given this product at a higher dose, of course, 3.5 grams to 4 grams, to control their bleeding, as well as people who have other bleeding disorders. So just keep that in mind. However, in dermatology, we use tranexamic acid orally as well as topically. So for the oral component, you would take about 500 milligrams up to 750. On the market is a 650 milligram dose, and you would take that once a day. So a lot of people will have you to split that into 325 milligrams twice a day. And what that does is that will actually help lighten the skin. Now, the problem is you have to make sure when your doctor prescribes this medication that you do not have any bleeding disorders. So you want to make sure if you are a candidate that had DVT, which is deep venous thrombosis or clotting in your legs, or any pulmonary embolism in the past, you are not a candidate for this medication because it will cause you to have that problem again. So again, like I said, is to stop bleeding. So it prolongs the body from breaking down the blood clots that our body normally forms in our that are normally formed in our body, and that's how it controls bleeding. So again, you can use this medication. You take it by mouth to help lighten the skin, and we use it for melasma, but you can use it for other disorders. Some people use it for rosacea. So because it does help with the redness of the skin. But regardless, you take this twice a day, and it takes a period of time to work. So you're on this medication for about 8 to 12 weeks. So you're looking at 2 to 3 months before you should stop it and to make sure you get the results you're looking for. Now, on the flip side, you can apply this medication to your face. Again, this is over the counter. So you can use this once or twice a day. And this is normally used for rosacea, but we do use it for melasma, which is, as you know, an increased pigmentation bilaterally on the sides of the cheeks or around the sides of the temple area. And we call that the mask of pregnancy, which you see women get this if they are pregnant or if they have a change in birth control, or if they start or even stop birth control. So like I said, any change in birth control or any type of hormonal therapy, they can get this condition. We see it in men too, but this is what we use tranexamic acid for. But for the topical presentation treatment, you will use it twice a day. And again, you give it time to work. But the problem is there's not a lot of studies to tell you how well it works. That's one. And how long you should really use it. A lot of people are using it now is in the way of injections, or if you ever had the we call it the vampire facial, in which we cause a condition which cause you to bleed. So we use a little microneedling, in which you use a little small needles that you poke in the skin, and yes, you have microscopic bleeding or some bleeding, but it causes your skin to heal faster and you look more youthful when you're done. Okay, so after you cause that injury on purpose to open those pores and to get those factors that heals our body and like I said, heal us, and we make look youthful, well, you would rub tranexamic acid or apply it on the open areas. And so it can penetrate the pores that you just caused trauma to. And that will help you to get a lightening effect on your skin also. So those are some ways that we're using tranexamic acid to give you that lightening effect, to get rid of the melasma or any other discoloration. And of course, you would need more than one treatment. So that's, again, another way that we are using this product. So just keep in mind, if you're taking it by mouth, and it's safe to do, you will need to make sure you get yourself checked. If you know you've had DVT in the past or pulmonary embolism, this is not the product for you, period. It's not worth the risk. And but that's what you want to keep in mind. Other side effects can be, if you take it by mouth, nausea, vomiting, headaches, and things of that sort. So again, this is something you want to get clearance from your doctor, but it does work well. So keep that in mind as another product that you can use to help lighten those discolorated spots that you do not want to have. Any questions? Thank you, everyone, for joining me and watching me on this episode. And if you have any questions, please put them in the comment section, and I will definitely get back with you and might even make a live streaming episode on your question. So again, I'm Dr. Johnson. I'm your host. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on facebook.com/Dr. Sonia Johnson. Again, besides that, you can also, if you want to have receive 3 free gifts or have a session with me, virtual dermatology, then you will want to go to iwantclearskin.com. And if you just want to buy products and, of course, receive some free gifts, then you want to go to gorgeous-skin-now.com. Again, thank you for joining me, and I will see you tomorrow. Take care. Bye-bye.